the elk will be all over.
The elk will be
Beautiful
all
season,
over
you know that.
the thing, yeah.
I have a story of when I was working up in the Estes Park office. It was mid-September, I come out. I'm in a hurry. I think it was going, so this is back in 2005 or six.
Uh-huh.
I was going for my master's public health at UNC, so to get down and get the degree. I come out and there are two bull trophy elk right in that parking lot. The school district was going at it, and what do you do? Right by the
Yeah.
vehicle.
Excuse me.
Sat back and went, for
Yeah,
about 15 minutes until he went up on the hill. And then I ran, car took off.
you know, when we had at the flood,
Yeah.
our house wasn't affected except for utilities. And so of course it took out all the sewer, so we hadn't found the house until after they did it. And when we shared it with our neighbors
last name Cross.
and there was an
Oh, I
elk
think I
that we tried to charge you every
I
time
know
we
that
went to
always
those
was the
outhouse. Seriously, and our neighbor got stuck in
it.
it because he wouldn't leave. And we were out on our decks You're gonna take
Oh,
over.
was it?
Do check.
I'm sorry, I saw you down there.
Yeah.
I get this one twice.
You're just
That's
good. You got It's nice. Yeah, really.
Public health. Yeah.
Me too, we're good.
I don't put it on my calendar.
Hey, Jared, you mind?
Like,
Pop it up there. Okay, thank you.
couple months.
Yeah.
Yes. Yes. And we'll have to, this is LA.
Holy moly. How are you doing, sir? Good, Tom. I'm doing great. Those smoke are great. Oh, the schools are. All right, it's 2:00. Let's get started and kick off the Larimer Regional Opioid Abatement Council Region 2 meeting for August 22nd, 2024. My name is Tom Gonzalez, the Public Health Director and the Chair of the Larimer Regional Opioid Abatement Council. So we have now called this meeting to order. Welcome, everybody. I appreciate everyone's involvement in this important subject. And we'll move to item number 2, public comment. Liv, do we have anybody from the public that would like to make a comment to the roll? Okay, no public comment. We'll put.
Could I do a proposal at this time?
This is a time just to make a comment for the roll, not for proposals or anything like that. But you certainly have an opportunity to make a comment. But it's a time to you just listen to the public, but there will be no interaction from the roll after decision, stuff like that.
Okay, perfect.
Okay, closing public comment. We'll move to the approval of the July 25th, 2024 meeting minutes. I apologize, I was not here. My first meeting I missed. I was on an airplane back from Detroit, Michigan. And so I will entertain a motion for those that were attending.
I will move that we approve the minutes as presented in the packet.
Second?
We have a motion and a second. Any further conversation? Hearing and seeing none. All those that oppose the motion. Hearing none. And Brian Mason, making sure you are hearing us.
Yes, I can hear you just fine, Chair.
Wonderful. Thank you, trustee. That passes unanimously. All right, we're moving right along. Agenda item 4, our fiscal grant administration. Carol, turn it over to you.
Actually, I think Jody was going to be talking
Okay.
about the state dashboard.
Yeah, and I think I sent it out to a lot of you, and I don't know Liz, if you could. pull it.
Yeah, that's got it
Okay, cool.
all ready.
Okay. I'll just start talking a little bit. Carol and I have been attending the regional opiate learning forums, and then also I don't know if it's so happening, Jack will have to play in the chapter, kind of the subcommittee of the data committee for the Colorado Opioid Abatement Council, and for that subcommittee. But they had shared with us this background and this dashboard. And I just thought it was something to kind of share today and go over with you in case you haven't seen it. And this will also be helpful with our dashboard that we're looking to put on our website. And I think they'll probably overlap quite a bit. We have been meeting with Dr. Gerald Olson and I, the Butler group, and the epidemiology group. And we are going to today, I'm hoping, Mr. Chair, I haven't brought this up to you, but we had this meeting that I might introduce a motion for us to put out a statement to our grantees for them to provide some feedback that is helpful for us to have for our metrics, but also for this dashboard. And so please if you can remind me, I'd like to bring that up today. We talked about this in the epidemiology group. But this is really cool. And if you're a data geek like me, it is using how the Colorado Opioid Settlement Expenditure Dashboard. And so I want to there's a demo board there. You can go on and look what that looks like, how it's spent. I thought we could go maybe and just look at some of the areas, and then we can look at some items if you'd like to look at. But this is overall, I believe. Let's see, I don't know if this is just an example of treatment, recovery, kind of harm reduction, how things are spent. And if you look at the actual expenditures or anticipated expenditures, it kind of is a nice graph. So if we could go to the local government page, yeah, thank you.
You might want to do regional funds.
Oh,
Local is like Liberty.
Oh. okay, regional funds, thank you. You're right. So here is the regional funds. I keep thinking we're region 2, but I was thinking local government. So these are the regional funds overall, expected over the 18 years, and right now kind of what some of the funds have planned to be out. So if you scroll down some more and kind of in MOUs and allocations and talk about the abasement councils. And I think if you push on settlement regions, keep scrolling down, it just kind of talks about the kind of the different distributors for the 19 regions. And if you could go back up a bit to learn more on that little, yeah. See if that loads. So here is kind of the Abatement Council talks about the Colorado Abatement Council and some of the things they're doing. Okay, it's hard for me when I'm not advocating, but if you keep going down, there's the principles, the past meetings, just lots of data. If you haven't been on there, is regional council funding. I'm looking for the map page.
So, yeah, go back.
Yeah.
And go back to that total expenditures.
Yeah, click on that one. Let's try that one.
And then when you scroll down a little bit further,
It's the map. Yeah, I'm looking for the map.
it takes it a minute to load.
But in case you haven't had a chance, I hadn't sent this all out. Remember, I said do not reply all, and I just was hoping you had a chance, but I thought it'd be great to talk about. So here is again kind of the graphs, but here's the regions. And so if you just hover over the different regions, let's go to 4, just to kind of which is the eastern part. And if we click on that, it should go up, and it should show up a kind of a little maybe not. Scroll up to the top with the graphs up there. That might be where it's at.
Yeah, I think that's showing what Ford has spent and anticipated to
So
spend.
they've only had $947,000, and that shows you kind of where they spent it and in other areas. So let's go back down to another region. Let's go down to let's just go ahead and click on ours, number 2. And then go back up. And it shows kind of where we spent and how we've expected through 2023. And then if you scroll up, it shows kind of the amounts for the 2 years, actual expenditures, and then by categories. And then click on expenditure by share. Just kind of shows in a different way, kind of just the amount of money and what's been anticipated through the end of the year and kind of expended. So what is expended and what's anticipated. And then if you go down expenditure subcategories, if you don't mind, let's just down a little bit with the other graph. Yeah, it was slow for me, but So that shows kind of the graphs, again, in a different way by subcategories. So just wanted to share this with you all. And if you click on the More tablet, which is up there at the top. See what it looks like, it's gonna bring up. There's just a lot of information there. And so I'm hoping, so share, state share infrastructure, that's other categories, and then talking about, but this is a really cool tool, I think, for some of the state shares and the infrastructure money that went out. So, and I just think there's a lot of data here and information about what others are doing. And then about the different amounts of money for each region for the 19 regions. So I just wanted to take a moment and let us kind of look at that. If you hadn't looked at the email and share a look at this, but I think it's very helpful and really a big step forward for being transparent, accountable, and helpful for other regions to look, but also for us to have just accountability and transparency for the public and for those folks out in the community that are interested in this. So I just wanted to kind of make sure if you have a moment to take a look at that. And I think it's a really interesting tool, and I'll be looking forward to seeing what our epidemiology group and how we took our data subgroup and to be a part of that. We met just this past week and how that all looks as we go forward. So any questions? Because I know Jack's online, so maybe we have, I think he's still on. Like, yeah, Jack's online. Jack, would you like to add anything else about the website?
No, I think you covered it very well. I think it is just a real step forward for the state of Colorado, and it just is a testament to the work being done across the state, and Region 2 is a leader in the state in terms of putting these funds to work. And I think it's really just interesting for us to be able to see how funds are being put to work. And if you drill down further into the dashboard, you can actually find the individual line items that kind of contribute that high level data. So you can actually see what programs were funded, what is a brief description of those programs and the recipients of those funds from each of those regions and local governments. So I think it's that, to our knowledge, there's not another state that has this level of transparency. And I think that is just, again, kind of a testament to the agreement that was reached with the local governments. And so just a big thank you to you all for putting these funds to good work.
Thank you, Jack. And I would keep drilling down, but since it's been taking a little while for it to load, I just encourage you all to go and check it out. There's some great information. And I think there's a lot to celebrate there, but there's also some things to learn from and see what others are doing. And so I know some of it's gone to the conferences and there's been some really great ideas. But every region's different, has different needs, has different resources available. And so it might just be kind of interesting to kind of look through all of that since we have that regional conference and the state conference and rethinking addiction coming up. It might be kind of interesting to take some time to look through that before we head to the conference, because you might want to seek out one of those regions and ask more questions. So I thought that might be another good tool, as that's coming to Logan, as you know, on September 30th, and rethinking addiction is on October 1st. It's a wonderful opportunity for us all to network and to learn from each other and to listen to those who are with lived experience and peer-to-peer sport and lots of opportunities there. So thanks for the time.
You bet. You bet. Thank you for bringing that to our attention. That's very good information. Thank you, Jack, as well. Any further questions or conversation regarding that, voting members? All right. Yes, Jack, I see your hand up.
I just wanted to flag on the conference. It did fill up briefly, but however, we've just opened up some additional tickets for the conference. So we do want to encourage regional council members and advisory members and members of the community all to register now while those tickets are available. And just a thank you again to the region for the sponsorship of this year's conference. It's great to partner with Region 2 and be in Loveland this year. So thanks again for your partnership.
Well, you're welcome. Thank you. And we're excited to have it here. And we're going to have a great conference. If you have the opportunity to attend, please sign up. Okay, we'll be, Carol, anything on the report?
No, it's just in the packet for information. There
Great.
were, big transactions this past month.
Thank you for that, Carol. All right, now we're moving to the big item, agenda item 5. That's the big part that we need to do today. Setting this up at the July meeting, again, I was not here, but watched some of the video and live, and everyone's filled me in. There was Laura Walker raised her hand and said, here's an opportunity to look at the 3 surveys and assessments that have been conducted within Larimer County. And she was going to put together a small group to review the master plan, the community master plan, the community health assessment, community health improvement plan, and the youth assessment, and see what those reflected as far as the priority areas that were discussed at last month's meeting. And that included people being pregnant. That's an additional one we added to the exhibit Schedule B. So with that, Laura Walker, Dr. Jared Olson, and Amy met, and they provided us with their review and thoughts. And this is a really good starting point for us, because our goal at the end of this meeting is to have this identified, the funds, how much for year 3, so that we can submit that to the COAG and meet the September 15th deadline. Is that correct, Carol?
It's the 18th.
18th.
And I did want to mention, they did add an additional deadline in November that if we chose to wait till November, then it's likely that the funds would come a little bit later, and that might not work great for some of our funding cycles.
And when you say later, how much later than if we got it in September 18th?
Jack might know the answer to that. That wasn't real clear to me, but I know that that didn't work very well for our group.
Right.
So Jack, did
Yeah, so we're generally expecting currently about a 3 to 4 month kind of period between the point of request and then those funds being dispersed is kind of what we've seen. There is a little bit of variability with the national settlements and the national administrator. But generally speaking, we would expect the funds, if requested in September, likely to be received in December or January, whereas in November, it might be closer to potentially into February or March, though it could be sooner than that.
okay, yes.
So, thank you, Jack. So, Mr. Chair, I know it's tempting to kind of delay this conversation, but we've already been on a pretty strong trajectory going forward, and knowing that we might not wait to see some of these funds and the funding till the spring, we have, I think, Carol, $800. We spent everything but $800 or something like that.
We've allocated.
Right, so we've allocated, so I feel like we really want to try to stay on our trajectory, because we put a lot of time and effort into this, so I'd like to stay to get, because we don't have a meeting till after the September 18th deadline.
So other voting members, any other thoughts, or would you like to stay on? Our goal is to have this wrapped up, ready to go, and Carol can submit it in before September 18th. Right. Okay, great. Well, let's move forward. I'm going to turn it over to Jared and Amy.
Okay, that's great. All right, so the request coming out of the last ROAC meeting was to take a look at what existing community assessments might have to say regarding the work of Regional Opioid Abatement Council. We took a look at 3 assessments. The community health assessment conducted by the health department, the youth mental health assessment conducted by the health district, and the community behavioral health master plan conducted by DHS. So with those 3, of course, none of those is specifically focused on the OUD crisis or substance use in general, but they do have some things to say. So in looking through the different areas of focus or emphasis, or even mentions of different types of priorities, we were able to just kind of do a very rough tier system to say, you know, these are recovery and community leadership planning coordination. Those are things that come up consistently and have relevance. Those are also areas that have been funded pretty highly thus far. So we put those in the high priority tier. In the medium priority tier, we have some of the prevention, which is specifically mentioned in a couple of the overviews. And then there's those that were not specified in the assessments or only briefly mentioned, not necessarily a focus, and those were in the lower tier. So we also noted that our current administrative fund balance is in excess of $450,000, and there may not be a need to allocate to that. And then just kind of given those rough tiers as well as previous funding allocations, we put some starting numbers there as a rough beginning for this work. Obviously, the council is encouraged to and should consider deleting particular categories, adding particular categories, as well as moving numbers up and down for the assignments there. But at least now you have something to sort of begin with.
Thank you, Amy, Jared, and Laura for your work. This is fantastic. A good start for us. So questions from council members regarding this for Jared and Amy?
I have a question. Thanks so much too. So and not specified in the assessments. So is that basically because it's not an assessment focused on this? And so that's why it didn't come up? Okay. So would we then bring in assessments that focus on that?
So I think I think that's an open question, and it's been up to the council itself, right? So what are the particular goals that the council wants to pursue in year 3? So you could approach this process by saying, we want to have 3 key goals that we want to follow for the next year and the next subsequent years, such as preventing overdose, preventing new cases of opioid use disorder, and supporting recovery or something like that. These are just sort of, here is what the existing assessments have to say with any relevance to this. So the council is obviously free to make its own particular priorities and say, we want to focus these funds or this particular spending on this goal. If we have that, we can then kind of talk about what the existing data says nationally, as well as in Colorado, or what the evidence-based practices are, what's recommended by SAMHSA.
Fantastic, because we have that prevention assessment report that's just newly out from the state. We've got other information from COAC. So I just want to use those that have prioritized that,
Yes.
use their information since ours doesn't.
I think that's huge, right? So this is what is already said in the community about community priorities.
Sure.
But again, we weren't asking specifically about OUD or SUD, right? So you should feel free to set your own goals, I think, for the council, without saying that this information is somehow binding, right? So move it up, move it down, as you see fit.
That question, Councilor Black, any others? Comments, questions from the council on this? Yes.
I would just, again, thank you. I think this is helpful. I agree, there's other studies and evidence-based practices that we know are needed or should be taken into account as well. Not surprised to see the recovery one in the high priority for sure. The community leadership planning coordination one, as we talked last time, the title's a little misleading on what's all included in that. If you read the text there, it kind of helps focus in, that it's a lot about treatment. But then the harm reduction one is surprising to me that, and I guess for me, it's because it's really specifically because the assessment or the reports you looked at probably weren't getting there, but we know harm reduction is very important as well. So I guess it's where one of the ones that sticks out for me. Mhm.
I think you can think about care coordination as that J3 category as being maybe a little more indicative or a more relevant title. And you can also understand why, obviously, recovery and supportive management for any type of SUD is something that would come up in behavioral health master plan, as well as care coordination, because we also know that we want to fill these gaps and not lose folks who are along their way on recovery because they can't access the resources they need or can't find recovery they're ready for.
So, and I really appreciate both of your work, and I think it is a great point, that all those surveys don't really address some of these things, and, some of these programs like the co-responder is fairly new, and there's really not been a lot of work. We know it's spreading. I'm just seeing lots of folks talk about, riding along with their programs down in Denver and their different groups, and now they're speaking up like, wow, this is amazing that these folks are diverting, people are getting support. And I actually received a text from someone today who was impacted by this, and I wanted to just share this with you all because I just couldn't believe it came in today because it's so timely. But they wanted to thank the council and this is a first person with lived experience, so I just want to share this. And it was kind of out of the blue, but they wanted to thank us and Behavioral Health Services because this has been helping their family, and one of them has a child outside of Lerner County who was in crisis and could not get services. And I was trying to help them. I said, where do they live? And so I won't go into the name of the center. It's very horrible, not politically correct name anymore, but there was no one to help them. And so we were talking about the services and what they have up here. So I just wanted to share this if you all don't mind, because I think we have, we're trying to also listen to folks with lived experience and things, and I just wanted to share this because it was very poignant to me. And then also, I could tell you stories all the time, but co-responders, please share this with your council. Co-responders have the ability to intercede with addicts when they are typically having one of the worst days of their lives. This is a moment they might be most willing to accept help. And I think of nearly a dozen interactions with my ex-husband. If he had with law enforcement during his addiction, that would have resulted in him getting substance and mental health treatment if only a co-responder had been present. Instead, he went to jail, and now he's more bitter and more hopeless, and eventually died of an opioid overdose 6 years ago. Co-responders are a game changer for people like my ex-husband and who are too deep in their addiction to seek help. And I wanted to thank you for supporting me and my child as we try to seek help. And I want to say that co-responders represent both help and hope. It's just timely, and I've actually had to send a co-responder team out to someone living in a cabin without running water and heat today for someone who's experiencing homelessness, who's older, who's has opiate addiction. I just can't tell you how timely some of this stuff is, and so I'm glad that they help them instead of hurting them. And I think you probably know about what I'm talking. So anyway, because they keep calling me. That person keeps calling me, so I just want to make sure they're okay. So I'm glad they're okay. So anyway, I just thank you for letting me share that, but I just think that we don't have a lot of data on this, and we're kind of leading the country in this work. And so I just want to make sure we're thinking about that as well. And then with the pregnant things, I find that I want to talk to you, Director Gonzalez. We have some information. You guys have been helping in the health department with pregnant women and their families with other kinds of substance abuse disorders. And I'm just curious, is there any kind of information or data or any kind of programs? I mean, because that's a good chunk of change, but it's some good work. And I know this was a new one that people are really interested in. But I wonder if there's any guidance of what we could do to have the best determined investment in helping it's helping really two lives and starting off with a really early intervention for a child who's, into such a situation that's not of their choosing. So I'm just curious about that.
Yeah, I think that's a great question. And we look to our Nurse Family Partnership Program that's been, we've had since 2000, it's been around since the 70s, very data-driven and critical period, and where having a nurse home visitor before pregnancy and up to 2 years afterwards. Many of my staff see substance use abuse and are working to get those folks the proper care and treatment, recovery, all those things. So certainly different strategies and approaches for that. And I was glad to see that was put to the priority list last month. But I would imagine just in our master plan and the 3 plans we looked at, that just wasn't something that at the time wasn't mean it isn't very important. So certainly different strategies to plan that. Jared, I'm sure you've got some research in that space.
Sure. So, certainly we look at genomic surveillance and we look at opioid overdose or opioid related visits. You can see some of them are births, right? So opioid impacted infants. So newborns. So we do know it's an issue. Certainly given kind of national trends, there's probably a couple thousand individuals who are parenting right now, like primary parents, mothers, who are struggling with OUD. So it's a category of use. We know that, there are certainly folks in recovery and folks who use MAT during pregnancy. That's a viable option, especially with the healthcare provider. As Tom mentioned, I think a close relationship with an active healthcare provider and early care during pregnancy can be really valuable. As far as the on-the-ground impact, I think I'd probably defer to some of our other partners for additional details.
Just to confirm the services and the impact dollars, do we have partners in the community that are working in this space that have applied for those funding? Are you aware of?
Tangentially, I think there's maybe 1 or 2 off the top of my head that are working specifically more in the criminal justice system that might be helping with
parents that are transitioning. So it might be a much more smaller subset, and they might be doing other things that I'm not aware of, that they haven't applied for funds for us from, but if you want me to look into a few, I can try to get back to you.
Yeah, I think.
I actually know quite a few. My son is in recovery and his new little wife was using and became pregnant and got her into detox services. And she has a lot of wraparound services right now. I can share all of those. But we've got those services, and I will tell you though that some of these folks they're scared to do that because they also know if they're in a program and they relapse, we will call the department of, because, if I found out she was using, she sends me her clean ways. So I know that she's still in recovery, but some folks are scared to get into the system to accept resources because if they relapse, there could be a heavy consequence. People will report you. So that's an issue now for mamas, especially mamas. And she has been off paper for 5 years, so she's not in the criminal justice system at all, but I will share this.
So I said, human services,
They will have,
we have
Yep.
all of that information.
And I'm sure,
and they've been fantastic.
yeah, and Laura Walker's the director, so I know she has somebody.
Yeah.
I guess I was surprised to see what, I know some are new, but I was just, like you said, the harm reduction, and I'm just kind of surprised, so,
I agree.
yeah.
I think some people don't know harm reduction, the only thing that when I talk to people, they think needle exchange. I'm like, harm reduction is so much more than that. And I wish we'd get away from that terminology. And so we can all work on that as we talk about it, quit using that terminology. But for the people I speak to, that's the only thing they equate to harm reduction. So part of that is more information that we need. They need education on harm reduction in general.
Can I make,
Shane had his hand up.
Good.
You're good? Okay.
can I just clarify something? So harm reduction, if it was crosswalked back to the previous years, was correlated with NCHN's funding. There was also peer support and harm reduction included in that J3 category through NCHA. So
Yeah, I think that's
the way that it's walked through.
Right.
There is harm reduction that is built into some of the other funding categories and is not exclusively within that H9 category because some of the larger agencies are doing work across multiple domains, it may not fit exactly into those buckets, which may give you some flexibility in how that funding is actually allocated after you assign it to particular areas.
I think you and I are spending too much time together because you're busy. That's exactly what I was ready to talk about after I was raising my hand and say, hey, are these overlaps here? So.
Yeah.
Okay.
Well, just for clarification, so this is a public meeting, but the ROAC, we have voting members and then we have our advisory members and our subject matter experts, and those are the ones that participate and help in the conversation. So making sure we're following that. Yes.
Mr. Chair, I'd just like to ask a question of our district attorney, Gordon McLaughlin, because he does serve on the still on the COAG, the Colorado Opioid Abatement Group, and we're very fortunate to have him here also as an advisor, and I just thought it'd be great to have some feedback from you, since you sit on both, you're an advisor for us, but you sit on the state board as well, just feedback on what you've seen and heard about today.
On our portion?
Yeah.
I think it makes sense. I mean, the statewide program, for folks that haven't been tuned in a minute, is just focused on such big picture efforts. That I think, our community, even though those are great efforts, our community doesn't feel them nearly as quickly as I think they feel these efforts that we've been working on. So I think these make sense from that standpoint. I'm always trying to make sure we're not duplicating things when I'm hearing what both groups are up to, and I don't think that's the case at this point.
Excellent, thank you. Appreciate your insights.
Yes, Beth.
Just one more thing, just for us to think about if we add or don't reduce some, just as you can see, as we spread it thinner, obviously there's less funding in each category. And so I don't know, at some point, there's a weighting, I mean, there is, because how it's split percentage wide or wise there, but just for us to think about, are there any of it areas. And a reminder too that we can shift these things, we can set this up the way it is, and then if we find out later we need to shift it, we can, but I wouldn't want us to add any more at this point. I think we've got some really good priority buckets that we've identified and we've already been funding and that we should continue fund in. And I do have a little bit of a question of if are there any that we maybe want to take out for now to have more funding to be able to go into some of those other ones. So that's all.
So there, I'll make a point and make sure. So what Beth is saying, Carol, we need to make decisions today, but it's not set in stone. If we find, oh, shoot, we want to move 10% here and that, we can submit that later on to the COAG and without penalty. Is that right?
Correct.
Okay. And then your question was to the council, is there, wow, we're spreading this out, or we're really making an impact. Is there something maybe we remove? Is that what I heard?
Just a question, I don't even have like a necessarily a recommendation there. I guess I don't know if in your research and in looking at other studies, if there's something that seems like it's being covered elsewhere, or there's not as much of an impact on the opioid specific abatement work that we may either drop down a little bit more or eliminate from our buckets.
So Cindy first. And then-
Yeah, I see.
To that note, I also think we need to, when we're looking at it, thinking about, is there other agencies that can continue this work under their funding? Or, help out more and so we can contribute less. I think that's a very important piece that we should also consider.
Yeah, thank you, Cindy.
So I'm building, that's where I was thinking, because I was building, gonna build off of that, because when I looked at this and I'm looking at some of those. I see that, as we had talked about all along, that the original 2 years, the original funders, we wanted to step those all down. And when I look at that, that's all stepping all of those down. If we kind of kept some of those same buckets and kept those same fundings, that's all reduced. In all those, they went to the same funders in those areas. And so they're all less, I think almost in every category, they're all less. And so that kind of goes along with our original kind of talk of the funding. And so I think that's great, could we kind of set that up that we were, they needed to look at going forward. And then also, as I chair the Behavioral Health Policy Council for Limerick County, we met in this room past Monday. We're getting ready, it's not approved yet, but the Policy Council approved almost over $3 million, which is over budget. And so they're gonna ask the Florida County Commissioners, I can't say what I'm gonna vote, but they're gonna ask us to approve going to find the fund to go up to 3 million instead of 2.8. And knowing what some of those, and I didn't bring them with me, but some of those potential awardees, I see some complementary overlap or some complementary overlap, but I do think these are still not covered by other things that are happening, and so I think that's, but I think there's some great leverage of resources, I would say. So I just feel, but not all of you have all of, I know Aaron's on, serves on that council for Loveland, so, excuse me, council of Loveland, sorry. And so I feel like there's some good, synergy, collaborative kind of leveraging resource kind of work, between the two different funding sources. Would you say, Jessica?
Mr. Chair.
Thank you. Yes.
Did anybody get a chance to review the document that Shane sent out prior to this? So that's what I'm reading too, and the prevention assessment report from the state. So one of the things in here is including direct funding to those actively using. And that's harm reduction. That's and it also says in this document, people that are actively using should be part of this process. And so I really think as a council, we need to discuss that, how that would happen. Because they have a voice to lend and they need to be part of this process, not just those in recovery. And so I think that needs to be a conversation, how we can get them in the loop. I know that I've heard from some folks in the city, well, we deal with agencies that work with this population. That's not good enough. we need to hear from those people directly, so we can hopefully have a discussion about how to do that. Not only that, those dollars, we gotta save more lives. How many are dying a day?
12, 13 an hour
So
In Limerick County or
in the
state?
country.
in the
In
country.
the country.
But and so I'm representing that. I would like to save more lives, the folks that are actively using. And, you know, I'm a proponent of co-responder programs completely and totally. I will say though, that they do their work. A lot of times there's nowhere to put these people. It's still housing. If we do not have supportive transitional housing, it's a lot of work for naught because they're right back on the street. And so I would like that to be a priority. So that's the two things that I would like to have a conversation about.
So,
Thank you for that, Shane.
Yes, sir.
Shane?
Thank you. Yeah, to touch on that, since not everyone in the room received the email I sent out. This was a letter with over 190 signees, including the policy, the Center for Health, Law, and Policy Innovation at the Harvard Law School. These are all providers and professionals working in the addiction and recovery space throughout the country. They put together a roadmap for how they believe these opioid abatement funds should be spent. It's a pretty powerful piece that they put together. The number one thing that they say this money should be spent on is harm reduction. That's top of their list. They also go on to say, and I will also include, I am a huge fan of co-responder policing. Their suggestion is that $0 of opioid abatement money should go towards law enforcement. And they go into a lot of detail as to why they believe that. I was doing a little math, and you'll have to forgive me, it's been a while since the presentation, the data may have changed. But I believe when the Lerma County Sheriff's Department gave their presentation, we learned that 2% of the calls of the co-responder units involved any kind of substance use, including alcohol. And that was about half of them. And I believe I'm also correct, the co-responder units are spending 50% of their time as co-responder units, is that correct?
As far as.
Their actual time on the streets, the two officers. Are they out 100% of the time as co-responder units or only some of the time?
Yeah, they permanently work out of their cars, so they start their shift in the morning. If it's a day shift at 7 in the morning now.
With a clinician
With the
on board with
clinician,
them?
and then they stay field, the 100% of the time unless they're actually
Okay,
helping somebody get to a hospital or getting the treatment or bring them to Longview.
crunching numbers quickly, so if they're spending 100% of their time with the clinician as co-responder units. Roughly $2,100 of the $210,000 is going towards actual addiction, substance use disorder related calls. And I just make that point because I've been beating the drum about efficacy and impact of these dollars that we have to spend. And it ties into these recommendations from this national letter. That was the point I wanted to make. Thanks.
Shane? Yes, Commissioner.
So, and Shane, I read that report and I do know that Jack and Jamie Bell with the AG's office been in a national conference and they have been looking at those reports and we're also being held up with what we're doing at a national level for what our response is. And our way of doing our response is really great. And I think that criticism is for some jurisdictions, which I agree with you, that they put the whole money in Tennessee to put the whole thing into law enforcement, not treatment. So that is valid criticism. But I think that if we're gonna apply the same scrutiny that we're saying, well, how much of this, all these programs, we went through all of those and said, how many percentage is really truly opioid abatement or fentanyl? I don't think anyone's gonna be 100%. And so I think if we're gonna apply that criteria to one grantee, we have to apply it to it all. And I do think that we have to think about we are stepping down some of these programs. We want to get them up. co-response, we know, as I read with this statement, it's saving lives. If that happened, that probably would have saved that person's life. And so we are saving lives, maybe not at the same amount, but this is a program that we need to keep going. We expanded it from 27% to 50%. I'm not advocating to try to get it up to 100% because it's going to take that long-term funding, and that is for another department. But I think that, you know, this is healthcare professionals that produce this report, which is very important to listen to. And I am a family full of healthcare professionals who've been dealing with this for 20 years on the front lines. So I feel like I have a little, and I'm also personally lost my family member, extended family member, to opiate use. So I just want to say, I'm not speaking just from the commissioner's hat, but also a personal hat. And I want to say that that is usually mostly what they're critical of, just equipment and items unrelated to solving opiate issues. It's about prosecution of distributors and users. And this is not on people-focused oriented impacts like the co-summer support. So I don't think we can compare this people-focused opiate user support and mental health support versus trying to say, don't put it into prosecution and things. And I think that, to me, the co-responder program, we got it up and running and we're ramping it down with this less amount and it's less than it's ever happened. And I don't think it's time to pull the rug out under that when we know that with Longview just opening up and the first 8 months, we're almost at 5,000 people. Do you know who's been bringing them in? Who only brought them in the first few months? The co-responders.
As they should.
And we're having almost 500 people a month being treated in this facility. And so we need to have that intervention. We're diverting people from the criminal justice system and getting them into substance abuse support and mental health support here. By all means, we never met at this council, we never said this was going to be long-term funding. But I do think this is great information that we look forward to for the next few fundings is where these funds are going to get lesser and lesser. And I bet we're going to be, like you said, trying to make the most impact with those things. So I really don't think we expanded the buckets last time to make this report so we have a little bit of flexibility. And I don't know, I know you all want to talk about moving things, but I still think if we look at our graph, remember that report, we were very happy how we had kind of a balanced approach. And I think that is still really a good approach going forward. And I do agree with you, we're trying to save lives, but I think all of these things are the multi-pronged approach to save lives. And I'm getting that text today was so reinforced that I think this is really important thing.
So real quickly before I get to Trustee Mason, we all have wonderful intentions here. It's a great council, one of the highlight of my careers, and it's tough. And those that are new or online, last year we had $3.1 million. This for year 2, year 3 is going to be 2.1. Year 4 will be 1.7, and it'll continue to go down to probably the last 10 of the 17 years around 800,000. That's how this was all front loaded and through the big settlement dollars. So there'll be some difficult decisions in how we prioritize that good intention of saving lives and preventing more to even get into this terrible situation. So that's wonderful. I think moving forward, I would like to ask Trustee Mason, because he has his hand up. He's been very patient. Thank you, Trustee Mason.
All good. Thank you, Chair. I appreciate it. Yeah, I do want to say I have to agree with the county commissioner on this. I am certainly, Mr. Ritter, I definitely appreciate the report you had sent over, but I think, the money that we allocate, and I know we can't guarantee that 100% of the dollars that we send to any of the grantees or anything like that are going to 100% be spent on opioid use and that sort of thing. We know that some of these dollars are going to, kind of funnel into, other things. And I don't actually know, in my opinion, I actually don't know that there's maybe much of an issue with that, right? Obviously, there's lots of other substances out there that, folks are having to deal with, whether that's alcohol or other things. Certainly, obviously, our focus as a council is to concentrate on opioids. And I think when we tell our grantees, obviously we can provide direction and emphasis as far as this is, we want these things to be spent on opioid use specifically, but obviously there are other categories out there. But I do want to emphasize that, when you think of, wellness checks or these types of things where, if I was to call and, need somebody to go out and, check on an individual or whatever that may happen to be, I think the first organization that most people think of is going to be your law enforcement or sheriff's office or whatever that happens to be in your jurisdiction. So that being the case, to me, it is important that we continue to fund co-response at the law enforcement level because, we don't want to be sending these folks to jail, right? I mean, it's important that, and I think Larimer County Sheriff's Office certainly understands that the diversion programs and these types of things that we are working on, this stuff all kind of goes in hand, right? We need to have those diversion tactics, and so having co-responders in line with our law enforcement and that sort of thing, I think that is, that's all part of the ticket. And certainly we don't want to have 100% of our money going to co-response. I think the buckets that we've set out are highly effective. So I guess my point would be that I would like to see us continue to fund our co-response units. I think they're very important in that regard. Certainly, I think from from seeing the impact that I've seen in Wellington here, a lot of that has gone a long way to keeping folks out of jail. So I would like to continue to see those guys funded.
Thank you, Trustee Mason. So, making sure, or you part of the subject matter technical, I just want to be fair.
Well, the only thing, Mr. Chair, I just wanted to respond to Shane since he addressed that directly to me.
Sure.
If I could take just.
Yes. Okay, I appreciate it. I just don't want to make sure others don't feel.
Okay. Yeah. So Shane, I appreciate your comments and your concern. I think originally when we reported the stats about how many of our calls related to drugs specifically, that was before we're actually capturing that information. So that number has gone up. I can get that for the next meeting, or I can get that to you through the council. I guess the second part that I would bring up is it's kind of already been echoed, I think, by Trustee Mason and then Commissioner Shattuck McNally. But if you actually look at the guidelines from this group, they're not really recognizing co-response or crisis response in law enforcement as a model. What they specifically talk about after reading that guideline or that letter that was sent out by those groups is making sure that it doesn't go towards law enforcement efforts for criminalizing, behavior of those who are addicted. And I think that's a huge difference. I think I agree with you 100% that using opioid abatement funds for law enforcement in the traditional sense would not make sense at all because that is just creating more problems. But in co-response and in crisis response models that we have with law enforcement, fire and EMS across the country, really what our focus is not the criminal behavior. It's trying to get to people the help they need. And I know the last thing I'd say is that I know of at least 2 people where, because of our co-responder, because of this funding, we're on scene and present, that we've saved at least 2 people's lives that I know of. You never know what the long-term impact is, but anecdotally, I can say that I've been on many contacts with current users who we've been able to help get them started with treatment and recovery by taking them to Longview or taking them to rapid access MAT. So that's very encouraging to me that we're seeing people understand that law enforcement isn't just there to charge them, we're there to really try to help in the co-response model. So
Thank you for that clarification. Yes, yeah.
Well, yeah, I appreciate Jane sharing all that. I actually didn't get that report, but I've read sort of similar things. I think I'd sort of echo, I think, what I heard Commissioner Shattuck McNally say, which is I think a lot of this pushback has been about some of those things, right? Like agencies using it for body-worn cameras and expanding jail facilities and so forth. And I'm really proud of this council's work for not having done those things. And I'll be brief since other folks spoke, but to me, I think one of the important points about the co-responder is that is a really big touch point for folks struggling with drug use into all these systems we're talking about, right? And while we wish, and I personally wish that wasn't the touch point, right? That the touch point was something outside of law enforcement or criminal justice. I think the reality is that is. So, in an ideal world, right, we would touch everyone with the harm reduction and the prevention efforts before anyone ever saw a co-responder or a DA. But that's not the world we're living in right now because we're so sort of far behind in this opioid crisis. And so I do think those diversion efforts from law enforcement as well as from my office are an important point of pushing back, right, against sort of some of those historic ways of dealing with the situation. And so for that reason, I support the co-responders. I'm glad it's a small bucket though, right? Because I do agree with the point that the majority of this money needs to be going elsewhere and into harm reduction type efforts. So I do really appreciate you sharing that. Appreciate you.
Thank you for that. Very, very good. Yes,
And just in looking at the treatment and then that harm reduction area. And I was just wondering, because I'm really kind of wanting to see more put in for the pregnant woman and the newborn child bucket. So I was just wondering what that would look like if we would just take those three that are non-specified in the assessments. So that are at 10%, and then 5%. If we take those three and evenly divide it, we could come out with each of those categories, raising up that women, because that bucket has never been funded. So I really think that needs to come up. It would bring up each of those to 175. I understand, I agree with the co-responder. I don't know, if because the agency, maybe they're able to, I don't know, have more availability to get grants, I don't know. And then how that would affect the harm reduction, those entities that we have put money towards, how bringing them down from 210 to 175 would affect. I just was wondering on that.
So, you know, I know we were trying to be careful of timing things today, and since we haven't had any presentations on this, we haven't had actual people come and present. I want to caution that we put, these are kind of just general recommendations, and we can go ahead and submit this as is. It's not set in stone, and then we can go ahead and start having these presentations and getting grants. But if they say, oh, we know there's so much, if anyone's gonna come and apply for the full amount, we know that with the Neighborhood Health Policy Council. A lot of those weren't fully funded. There was over 80 grantees asking for over almost $12 million worth of money. And they all asked for the maximum amount. So there was a lot of hard decisions to go up and down, and that was done way after the application. So for me, this kind of gives us that overall foundation and base to go forward. And then we can have these folks come and present, because we don't know who is the program and human services and how much they might need or not.
Well, that's why my suggestion of equaling those three categories out more so than
my suggestion is, because we had the subject matter experts and the staff who went and looked at all the different assessments and surveys. And this is kind of a recommendation, it might be a good place to start until we hear back from actual grantees and the amount of things, and then we can tweak it after that.
Yeah, and that's why I was pointing out the non-specific, because we didn't have anything on those. And those are the categories that, that's why I included just those three, because they weren't any specific assessments for those. On those three only.
saying that, so I understand you.
You said, yeah,
Issue,
and you
trustee.
made, yeah,
Instead of 10, 10, 5, they would be an even percentage.
like 7, yeah, right, exactly. Those three only, because there wasn't any specific assessments on those three, is to even those out a little bit, to give those percentages equally along those, knowing that we can make, like you said, make changes as we go, but it just evens those out a little bit.
So you put that, I just want to make sure, do others agree with that concept?
Well, can I ask a question of Dr. Olson? I mean, I think they just, when you sign those percentages, it was kind of art, not science.
That is correct.
And so it's not,
It is correct.
that's
Right.
why I'm
Completely
saying,
editable by the council.
Right, so I feel like they're flexible, but what I'm saying is if we set the numbers, like someone's gonna come in and say, okay, then if you're saying it's $367,500, I'm gonna come in, one person's gonna come and ask for all that money. And so I'm saying if we just kind of set this for right now, and then we get these presentations, and then we find that, hey, if we keep in kind of the general percentage, let's say maybe we're not going to take pregnant women and make it 30% of the funding, right? I don't know, but maybe if we get a really good proposal that has, but what I'm saying is I think until we get kind of actual grant proposals and allocation proposals and actual numbers and find out what might be, because I know any nonprofit's gonna come in and say,
Exactly,
Yes.
that's why I wanna bring that down from 210 and even it out, because I don't want them to think that they could have that one test 210. You know what I'm saying, personally.
I just wanted to ask a clarifying question, to put this together, the color coding for it?
Is
Do they roll up into those bigger categories, or do they actually have to approve about a subcat?
oh, I'd probably defer to, but
Carol?
these are, or Carol, the categories are, so treatment is one category, but the exhibit E, Schedule B code is the pertinent one. Does that make sense? Yeah, so the color coding is for the type of emphasis, so treatment, and again, these are all bleed into one another, because, for example, harm reduction, obviously leads in many cases, right? So NCHN's report, about 10% of their contacts were leading to MAT, right? And conversely, a lot of harm reduction, including fentanyl test strips and naloxone exists in that J3 category as well, right? So there is overlap between these. These are fuzzy to a certain degree, but in the assignment of the categories for the AG's office, you'll have to put a dollar amount in each bucket.
So I think to that note, I would change my recommendation a little bit and just keep it within those two treatment areas. I see where you're going. I was more focused in the non-specific assessment. But take those two treatment areas and equally divide those up. Knowing that we can change it, but also knowing that we don't, we may not have any or many for the pregnant women, and we may have tons. We don't know. We kind of know where the co-responders are needing, their needs are. So maybe taking those two categories and divide that up a little bit better. Equally.
and what I'm thinking is, like you said, it bleeds, we get a presentation from one organization who can do recovery, prevention, harm reduction, and part of that is also the needs of pregnant women. And they can have like 4 of those categories in one proposal. That's gonna be complicated, but I think we've already had some of that where certain organizations are hitting more than one bucket. And so that's why I'm just thinking this would be a good place to start until we get those presentations, and then we can say, okay, this organization came in and they're presenting this, they can do B2, J3, and they actually have this really promising and great program for E3. And because of that, they're going to ask for 650,000, and they can do all of that for 650,000. Then we can kind of adjust it then, and that then will leave us with the rest of the programs to kind of adjust after that. And I hate to start tweaking it now, when we might tweak it again, and I'm really curious to see the leveraging of resources between some of these folks to see what we can do to also, I want to cross-reference other things that they have, other grant programs that have gotten, so that we can help maybe fill in gaps for folks who are trying to they've got so much here, because they needed full funding here, but they didn't get full funding here. They're gonna find that out during the next week or two. And then they might end up coming and asking for funding to fill in the rest of the gaps for that. Does that make sense? And so,
Oh, yeah, I get that. I just would like to see those two categories a little bit.
Sorry, I did not mean to interrupt.
No,
Sorry.
that's fine.
What I'd like to do, because we do have two, one to leave it as is, one to tweak the green treatment section. I want to see what the other council members have. And so I'm going to start with trustee Mason. Where are you leaning right now? with those two concepts.
Well, I think what the commissioner said is actually pretty important, right? I mean, the fact is, this is certainly not the last time that we're going to very likely tweak some of these buckets. I think where things are allocated, just me looking at this here, I think I like where we're at right now. Again, knowing that it's very likely, some of these things are going to change going forward, so.
Okay, thank you, and that is the good piece that we can't tweak this. Councilperson Black, please.
I think I would lean more toward making those all the same, I guess 7% or whatever that is. I'm still, I mean, I know a lot of harm reduction is involved in these other ones, but I would still like to see that percentage higher personally. And if we've already given over $500,000 to the sheriff's department for the co-responder program, I'm not sure where your funding's gonna come for future year after year to support those positions. But I think personally, that's a huge bucket of those dollars that have gone to that, and it is time to spread the love and it's harm reduction. So that's my opinion.
Well, thank you for that.
Yes, sir.
I guess I'm feeling a little bit okay either way, because I feel like we can come back and change it. So I'm curious to see what our specific needs are in Marion County that aren't getting addressed already for the pregnant women and their families, and seeing what that need will look like and what we'll need to do there. I personally think as much money as possible in recovery housing and supportive housing is kind of my passion, where I'm at. I think it's at a decent place. I would love to see it higher, but I don't think we're gonna get there with all the other priorities. So I'm pretty happy with that as it is and could go with it.
And from my point, I respect their work as well as all of yours input, and that we can't tweak this, and we've got a good starting point. And I agree, housing is kind of more where I think we should be working harder on just by the data. So I'm more vote that we just keep it as is, submit this, and work hard to make sure we hear from the community and learn where gaps are, especially with pregnant or women, because that's a huge passion of us at the health department with prevention. But maybe there needs to be more funding there. I don't know. So that would be my sense.
So I agree with everything said. I just think we have a lot of needs that we know from the behavioral health. And we have a lot of folks who need funding, and this is really low bar funding to go get. And so everyone's scrapping for dollars. We know the funds are gonna start wiggling, but we have a long-term kind of funding here. So when we talk about these things, I'm very interested as we look at, we have some 6-month reports coming and some other data. And I'd love to see some of the housing data and some of these things that we can grab. And then also just as we get to this approving this and things, and we're having the conference, we can talk to other folks. I think this is the chance for us to dig deeper before we finalize the allocations. And I think today that's gonna be hard to do when we don't have agencies or numbers or actual what is gonna happen. So I do agree, it would be great to keep it, but I'm very curious about the pregnant woman, what kind of things are out there and what it would take, but also how is the housing going and what are the extra needs? And then also I wanted to mention it's Fentanyl Awareness Day yesterday, and I see that the Connect Effect, that's through the program, and Sergeant Cook basically got those in every school, in middle, high school, middle school in Larimer County. Thank you again, Sergeant Cook. But the local police department, others are actually doing that in school, we're doing a big event. I know we didn't recognize it, Fentanyl Awareness Day. I just wanted to bring that up too, in case I forgot, so.
So call our youth, their video out on.
Had it. That was great. I went to the premiere of the lyric.
Thank
It
you.
was, if I may just take a second, the youth that did this, that was a national application. So that's a really big deal that those kiddos got that. But the adolescent who played the part of the individual in the movie that overdoses was in the audience. And so, the lights come back on and I go straight for that face. Because we're here. You know, because it was a very moving video. If you haven't seen it, go support those kiddos. They also have shirts that you can get to say fentanyl kills, their own design and everything. So they were really proud of it. And I was just happy to see that child's face. Oh, I've been not paying.
So thank you, excuse me, Sheriff. So we went around and got, where do we want to go next? Is there?
I'll make a motion
Okay,
to accept, staff's recommendations as presented today. To go ahead and submit this to the Colorado Opioid Abatement, Council and Group as our 2025 funding. And as a caveat, just knowing that this is not for etched and granite yet, but this is kind of our buckets that we're working for.
there's a
I'll
motion. Did you second that, trustee?
Yep,
Gibson?
I'll second.
We have a motion and a second, and let's read back that motion, Liv, so it's very clear.
Move to accept staff recommendations as presented and submit to the state for our proposal.
Okay,
For 2020, for 2025.
for year 3, yeah.
Yeah, 2025.
For year 3.
Yep. Or
With
is
the
this year 4?
understanding that we can make changes.
Yeah,
Then I'll vote for it. I don't know, maybe we can have Jack confirm that, so it's his
Jack, does that sound like we're on the right track?
Sorry, can you repeat that?
That we're gonna approve this presented buckets of funding and subcategories as it is presented in subject, this is what's in exhibit E, and then we're gonna approve what is up on the page, staff recommendations for our year 3 to 2025 funding, knowing that these are not, actually, year number 4, sorry. Actually knowing that these are not etched in stone, but this is what we're gonna present to you all for our year 3, knowing that we can tweak it going before, as we go along.
Yes, so you'd be just taking the finalized amount and applying those percentages to it. Is that correct?
Yeah.
Yes, then I think that sounds great.
But we can still go back and kind of change those percentages going forward.
Absolutely, yes. You'll be able to amend your plan throughout the year as needed.
that's perfect to put in
So
there.
there's not a minimum timeframe or a minimum amount of times we can amend that.
There is no limit on the number of amendments. The COAC has asked that regions don't amend in the month ahead of the expenditure reporting, which is just January. But otherwise than that, there's no other limits set kind of on submitting amendments.
Great question. Okay, can we read it back to Jared and then, or Liz? I just want to be crystal clear with this one.
We move to accept staff recommendations as presented and submit to the COAC for year 3, 2025 funding with the understanding that changes can be made. The plan can be amended up until January.
I just wanted to,
I don't know if we need that amendment until January. Can we?
Any month other than January.
Yes.
and I just wanted to point out to the voting members, there are 2 zeroed out categories that were included in the initial proposal. So the administrative funds because of the $450,000 excess balance. And then the data and communications, because that has already been currently addressed internally, and if you'd like to make changes, we felt the money was better spent on issues.
And I noticed that, but I'm saying we're presented as a presented, there's 0, but there's still buckets that we approved last time in case we decide to change. Knowing that we still have some administrative costs, but I hope this is how this year we've used more administrative time from the county than ever. And I want to be very as someone has watched my budget, Blair County's the fiscal agent, but we're doing a lot of heavy lifting. If you look in here, I have 1, 2, 3, 4, 5, 6. Yes, you do. Seven people in here that are taking Blair County funding to support this project. So just wanna, just wanna kind of staff time and just wanna make sure. Glad to do it, but just knowing that's cost administratively.
So we have a motion, we clarified the motion. All those in favor of the motion, signal by aye.
Aye.
Anybody oppose the motion? No opposed, so that passes unanimously.
Thank you, Jack.
Hey, great work. Wow. Yeah, Jack, you're a godsend today. Thank you so much for being here. You did ask that you add an item to the agenda.
Yes. Yes.
I just
Remind
wouldn't-
me, Dr. Olson, remind me of the question, please, because
Sure.
my brain all of a sudden just went completely blank, because I am like quadruple booked tonight, and I try to figure out how to get to four places.
So there was a question about the subcontract to the Butler Institute. And their ability to provide support for grantees in designing a data and evaluation plan so that they can maximize their reporting for the 6-month and the 1-year reports for year 3. They have sent out to the funded organizations a email saying, you know, this is who we are, and introducing themselves and talking a little bit about what they may be able to provide. There was the question of whether we could send an email from the ROAC itself as the grant funder in order to encourage grantees to use that resource.
Yes, and it's always sent out, and we've been in that, you know, we put our subcommittee for data into this epidemiology group, and there hasn't been hardly any response at all. And we think that maybe that's because the grantee might feel that this is going to count against them for asking questions or having concerns. And so we wanted to kind of send out a note of approval from the council, encouraging them that this is to be helpful, to ask how we can do better, how can we make it easier for them, or how can we help them share their data, and to encourage them that as a council, we're asking for their help to help us do better and help them. So I figured we could not send that email out without permission from the council, since we're representing the council. So I don't know, did they send the email with the language?
I have a draft right now that we could either take a look at, I could read it out, I shared it with Liv, she wants to pop up there.
So I just wanted to make sure you saw that, because I don't, the subgroup, we don't speak correctly. I'm there representing the council, but I want to make sure you saw it, and we could approve that to go out.
Is it on the agenda?
It was not, but I'd asked.
I'm concerned though that that wouldn't have public notice.
Is David on
and
here?
we're having a
David?
conversation
Thank
about.
you, I appreciate it. Councilman, Deputy County Attorney, David, are you available?
I am here. I am in a fight to the death with my Zoom program, so I can't get my video.
Did you hear the question at hand?
No, I did not.
So, a council member has raised an item for a vote or consideration that was not on the agenda. Do you find that an issue because it was not on the agenda and not posted 24 hours before the meeting?
Let me look. So I have the agenda pulled up. So you're saying that there is an issue that was raised that was not indicated on the agenda?
Yes. And Commissioner?
David, it's County Commissioner Joey Shabby-Valley. We're in the epidemiology group, and we're just asking council's permission to send out a statement to the grantees to ask them, to encourage them to participate in the survey with the Butler group. And so I figured that might fall under kind of grant administration, and so I just, we just wanted to get that out because we're not having responses from the grantees, and we wanted to kind of be able to get that back to continue the work there. Of course, I understand about 24 hours notice, but I just was hoping, because I'd asked the chair if I could add this onto the agenda at the beginning of the meeting to ask a question of the council. So just so you know, I did bring it up at the beginning of the meeting.
Did I hear correctly? I thought I heard reference to maybe a copy of that letter.
There's a motion, yeah.
The-
Copy a draft.
Okay, was the draft of that attached to the agenda as an item that would be considered?
We didn't have that because we had just met on Monday. And so we didn't have it before it went out, and I didn't see it. I was going to try to send it out before the meeting, but I didn't see it. And I guess it's available now.
Yeah, I understand that completely. Unfortunately, I would have to advise that since none of the document was attached and there wasn't a specific line item to acknowledge the public to it, that you need to move it to another meeting.
So I get that and appreciate you keeping us.
And I love Butler, but.
I know.
Yeah.
No, I know. We have to do this.
We just got
properly.
caught on that this last week. It looked like.
No, I know. So David, is there any other way we can send this out to the council and have them at least see it, and because we kind of need to get this out so we can get the data rolling from to keep the Butler progress going forward.
A provision that allows electronic communication. My suspicion would be that you don't, and that any action by the council would have to be in an open session, in which case it would require an agenda meeting. It's not to say you can't set a 5-minute meeting at some point in the future, very soon, just to deal with this. That's possible, but you'd have to have a published agenda.
Thank you, David.
Yes, Chair.
Can I suggest that we take this time in between and make direct phone calls to the grantees between the Butler Institute and the health department, and we'll do that, and then we can plan on following up immediately after council's next meeting in September with this email to kind of get one more touch point.
That would be great. I would ask, Mr. Chair, to put this on the agenda for next meeting.
Absolutely.
Thank you, Dr. Olson, for the suggestion.
Great job, Gary. Thank you, David.
Certainly.
Okay. Good work here now. Next steps, that's not on the agenda. We're not voting, it's just some ideas for our next meeting. We do have our priority areas. We have not etched in stone funds. How do we want to start working on how do we start etching this? Yes.
So I have a question about that, and then one other point before I get to that is I would love to give Jack a little time at the end, just to again remind everybody how to sign up for the conference and kind of make sure that they know how, that they have to sign up. But my question is, we received, as a council, we received some folks who have asked to get on the agenda and to present, and we haven't had, I don't know what our process is for who presents and doesn't. Because we don't want to do this like either presentation, so, and we also have the 6-month and the year presentations to fit in as well. And so I don't know what kind of process we have, how we fit this all in. So I'm just curious, do you feel like we have a process, or do we have a process, and should we just talk about that? And we also have the capital policy, asset policy we discussed too.
So what we did last year, and I did provide that in the June packet, was we carried on our routine work, but then behavioral health gave us contacts of folks working in those spaces, and this would now be the addressing needs of pregnant women. We brought back our ones that are already grantees, and then we took anybody that reached out to us, because it's at the time we discussed, we were going to take a targeted approach, not a RFA or a peak approach, because we just don't have the staffing. So that would be the approach we did last year. And it took us a couple months to do that. It was October, November for those presentations.
So I know we have that presentation. And I agree with you, and thank you for reminding us all of that. We have some new folks that have contacted us, and
We had that last year, we just put them in and they came and presented.
okay, so but if we have, let's say tomorrow, floodgates open, we have 20 people.
That's a great question. We would need to have a conversation again about how we would handle that.
Right, so that's kind of what I'm asking is how we can handle that, because I'm also wanting to know, maybe from Carol can say who's the 6-month and year reports, and we should probably get those put those on the agenda so that we can go around those, because we need to have those. That has to be, if it's open. Oh, thank you. Thank you. It's on the page. So I just, thank you for reminding me that it's right here. And thank you, I think Carol did that, correct, Carol? Thank you.
That was Liv.
Oh, that was Liv, thank you, Liv. So that's exactly what I was thinking. So when I looked at this before, like, oh, this is what we can build off of. So I'm wondering how we fit in other opportunities.
Other suggestions, thoughts from the council? We do see commitment in September. We have the Alliance and the Network 6-month report. We do keep those less than 15 minutes, 10 to 15 minutes, we ask. And then the option would be start putting in our current grantees and ones that have reached out.
And also I think we should talk about that capital asset policy in September. So.
Okay.
And hopefully, Jack, I don't know if you guys have had a chance to look at our recommendation yet.
So with
I
that,
have-
just so, council members, is that a good plan for September and October, moving on to get this etched finalized? Plan is what we have committed for September, and then we start bringing in our current grantees and those that have reached out to us. And we get information about, where the needs of pregnant women.
In October.
We start that in September.
When you figure how much time it's gonna take per presentation, what, I'm curious as to what that looks like then for each month, how many presentations that we can handle for the 1.5 hour slot, or do we already know that based on how long we're going to allow for a presentation that we need to have a 2 hour? I mean, I was just wondering.
Sure, we start, when we get those, we start building the agenda based on. The previous grantees is not near as long, they'll say this is what we can do, as they knew they were kind of ratcheting down. New grantees, yeah, those take longer because there's questions, the council's getting to know them, so those we typically schedule
Yeah, I was wondering how long we scheduled those for last year.
15 minutes, and that was
So
not
those
enough
were
for the new
15.
ones.
Okay,
Those-
so that's what I think we need to look at is, and have that guide. You know, if we want new ones to have 25 minutes, say, you know, okay, well, we can have, 5 on X day. You
Yeah,
know,
that's what we'll
and
do.
build that out,
Yeah.
okay.
Yeah, we're starting that in September, thank you, yeah.
Well, and I wonder for existing grantees, if we're looking to help some of these folks leverage their dollars, because it gives quite a bit of credibility if they've got specific funders on their funder list. They've had that, they've gotten money from us, and so I'm just wondering, I mean, we've got a lot of agencies doing this kind of work, and so I just wonder if we're also assisting them in their leveraging their dollars, then I would like to see more new agencies come in. So that we can help them with their dollars. And as far as existing grantees, if it's not a final report, if that's not the presentation, then maybe that's a quick, I don't know, like something, a 5-minute video or something. We might not even need to see them in person. I don't know why we would.
Well, in case we have questions about continuing funding, we need to be able to ask
So,
questions.
but is that a final report or is that a presentation you're requesting new funding?
Yeah, they would be requesting for years to, if they want to participate.
If they want to participate, so
Yeah,
that's.
yeah. Yes, sir.
And I did want to mention on the 6-month report, the way we fund our grantees is we give them half of their funding up front. And then when they do their 6-month report, if the council is satisfied with the direction that they're going, they would vote to give them their next piece of funding. So that report, that 6-month report is pretty important. And it's important to give yourselves enough time to make sure you're satisfied with the work that's been done.
Yeah, those will be.
Councilor Black, Councilor Black, that's what we said at the beginning. We just want to make sure that before we hand it the full check, that they were making progress, but we also, but that's been there from day one, so just want to make sure, because I know you've been there, what, a year?
I've been watching them since
Yeah.
inception.
So, but I feel like, we've been trying to, we wanted to kind of also get feedback in case they needed support too. And in case they needed support to keep, like a tweak or something, it's not only accountable, but just to be supportive, so as well. As I took it, we were trying to have communication, so.
All right.
And the only thing I would add
Yes.
to all of that is, I do think on occasion, we may need to extend a meeting if we have more, and potentially if we get a bad rep, we may have to add a meeting.
Yeah.
There.
Absolutely. Yeah, thank you for that. And I mean, I just look at the lift we've got here and to give enough time. My looking at the council's suggestion would be the rest of the year, just go 2 hours and just get it on your calendar now. It helps me.
That's how.
If that works for everyone, so we aren't sitting around rushed. We had that happen when we left last year, and that was not, it was awkward to the grantee and all those things, we don't want that. So my suggestion would be, to just extend these meetings for 2 hours going through December. Yes.
I know I keep saying this, but I do think, and I'll go back in touch with Jake Feld and Jack again, but I do think before we approve new grantees for the year 4, and just can't believe it's year 4, that we have that capital asset policy in
Yep,
place.
you got that.
And I just, in retrospect, I mean, we're doing things a little bit differently in other regions, because Carol and I have been going, they're kind of afraid to do any kind of capital assets, and so we've really been kind of the leader in that. I feel like that would just help us kind of cover some bases. And I think what has been proposed is really great, and I appreciate David and Carol and everyone who's been working on that.
Yes, Carol.
No, go ahead.
I just wanted to remind the group that in the past, we've used grantees that have already received behavioral health grants. And that means that the behavioral health department has vetted them and kind of looked at their financials and, you know, they're like, we're comfortable with these folks as grantees. If the council goes outside of that model, we're gonna need some sort of a way to vet them before we give them funding. You know, some of the grantees are new, they might not have the financial capacity to do this work. So that would need to be built into the schedule if you go outside of that.
Thank you very much. Yes,
I just didn't know if you wanted me to make a motion for that 2-hour
that
extension.
would be good to have that motion.
So I'll make a motion that we extend each meeting until the first of the year to 2. I'll second that.
There's a motion second. Any further discussion? Anybody opposed? Get that on the calendar for, that passes, we'll get that on the calendar. All right. Any, yes,
So for our members that serve here in recovery, are we, if they would like to attend this conference, it's gonna be, are we helping them attend a conference, or how does that work?
Yeah, I'll let Jack talk, because I was gonna ask Jack to
I
talk
don't know if
about
are
the
interested
conference
or not.
and about the co-ed conference. That's different than Rethinking Addiction. Rethinking Addiction is free, if I remember right.
I think so.
Yeah, it is.
That's the second day on October 1st.
Yeah, so.
Yeah, I tried to register for the co-ed conference and it's showing it is sold out
Jack,
just now.
during this.
Oh, cool. Thank you for trying. We got real here.
so Jack, would you mind sharing about that?
Yes, and actually there should be tickets available currently. So I'm just gonna double check our system, but we did reopen some tickets earlier today as we did fill up initially, as we're now at around 300 registrants for this conference, which is very exciting and kind of a top of previous years. The conference agenda is now online, and I'll put it in the chat if Liv, if you could share it out as well. And I'll also put the registration link, which is above it as well. But we're really excited to feature both spotlight of kind of community innovations and emerging practices and really highlighting some of the work that's being done in Northern Colorado specifically. We'll be having a panel focused on medication-assisted treatment in jails, which will feature Lieutenant Stacy Schaffer, as well as we'll be featuring in the afternoon, we'll be having 3 different tracks of sessions. We'll have a regional operations track really focused on the regional councils and of the operations of those councils. Leveraging resources track, which will really look at kind of what are those available state agency opportunities, how do we sustain and braid programs with Medicaid and Medicare, as well as we'll be featuring kind of a work of the Connect Effect campaign and the resources available to leverage that are available to leverage from the state. And finally, we'll have a communities in action track, which will have a panel focused on addressing the peer support workforce. We'll also have a panel about recovery-friendly workplaces. And we'll then kind of conclude those panels with focus on new strategies in law enforcement, as well as a panel focused on supporting families, including those affected family members who have suffered overdoses and losses in their family. And so, so just pulling up that agenda right there. And so, and then again, another thank you to Region 2 and Larimer County itself for sponsoring this event. We're really grateful for it and excited to have kind of a really packed agenda. It's a one-day conference this year, so we really have packed in a lot of information, and we really hope it will kind of help regions both see some of the success stories that are happening already in Northern Colorado, as well as hear from other regions and other kind of experts and subject matter kind of stakeholders in this work. And so, yes, we should have some seats available, and if not, make sure to sign up for the wait list, and then we can make sure we should be able to send you an email to let you know that the tickets are available if for some reason it shows that there's a wait list.
And Jack, I see that it's registration for the dinner, because I know that dinner is even tighter. How is that?
Yeah, so we are currently working on the invitations for that. So that will be a separate registration, which we'll be sure to share out and kind of be inviting the regional council members specifically and stakeholders. And so that will be kind of some additional information which we'll share with the sponsors to share out with their councils as well.
Thank you. That's what I thought. Thank you. Exciting. We're so excited to have you come.
Yes.
Thank you, and thank you to the city of Loveland for hosting us.
Actually, it's at the ranch, which is owned by Larimer County, so it's actually the Larimer County's ranch.
Oh, thank you, thank you.
Right away from Aaron.
I know.
All right. We've come to that great work, everyone. Does anybody want to make a motion for adjournment?
I'll move that we adjourn. Second.
Anybody want to discuss that further? All those in favor?
Aye.
Great meeting, good work, you guys are awesome.
Thank you all.
Saving lives. Thank you.
Hopefully it'll be-
Thanks, everybody.